In this video, I'm going to talk about chickenpox. So for introduction, chickenpox affects all age, but peaks in those children that are 2 to 8 years old, and it provides a lifelong immunity after recovery from this chickenpox. This disease is very common and it is highly infectious, but it is a benign disease which does not cause much harm. So for etiology, it is caused by the Varicella zoster virus. It is highly infectious during viral shedding, which is 2 days before and 7 days after the onset of rash on the body. The incubation period for chickenpox is around 10 to 23 days, and it is spread via respiratory droplets discharged from ruptured lesions on the skin or conjunctivae. The clinical features of chickenpox include symptoms like low-grade fever, headache and malaise, and also skin rash, which appears in crops for 3 to 5 days. It starts on the head and the trunk of the children, and on day 2, the trunk usually has the most number of lesions compared to other parts of the body, and it gradually progresses to the peripheries. Whereas for signs, there is the characteristic vesicular rash, where at first there are small macules, which progress to papules and become vesicles and pustules, and then it will dry up and there will be formation of scab and crust, which will fall off within 1 to 3 weeks. And besides that, other signs of chickenpox are pruritus, which is itching of the skin, and scarring does not occur unless it is complicated by any secondary infection. So this picture over here shows the characteristic vesicular rash seen in chickenpox. For investigation, it is usually a clinical diagnosis and lab test is unnecessary. But for definitive diagnosis, we can do PCR, which is a diagnostic test. We can also do immunofluorescent tests using monoclonal antibodies, or do culture of the vesicular fluid to detect varicella specific antigens. For treatment of chickenpox, majority of the cases are mild and only need symptomatic treatment. For example, giving antipyretics for the fever, and also cool baths, and also careful hygiene for the children to prevent transmission to other children. And oral acyclovir is not recommended in otherwise healthy children who is infected with varicella, where IV acyclovir is only given in those immunocompromised people to prevent severe complications in chickenpox. So that's all for my video. Thank you.